What I'm going to do is I'm actually going to sit down here because um, the talk last time, the last talk was great and it filled me with a lot of passion. I don't want to dance around the stage while I'm doing this. My name's Kanav. I'm a health technologist. I happen to be an engineer and I also happen to get a PhD. That's why the doctor next to my name. My mother always reminds me that I'm a fake doctor. So for those of you who are actually into it. Let me talk a little bit to you about primary health, right? And I'm kind of passionate about this topic because I think that most of us don't think about it, especially you guys. You guys can eat a burger followed by a pizza followed by 5 beers and still wake up in the morning and be fine. Trust me, by the time you reach 30, that's a little less possible. And by the time you're 35, it's completely impossible. When I was 28, I could pretend to listen to my wife and watch television, and now I can't bloody multitask. It's just gone. So, you know, yeah. So then I have to listen to my wife. I thought do roti khayegi side pe padi rahegi, but no, that didn't work. Jokes aside, she's a doctor herself, and we have a lot of fun together, and we've built this vision together, and I want to talk about it. Okay, I don't know what's actually going on with this slide set. It should have this. But, you know, primary health is something that really does define what and how well a country does. In our country, unfortunately, which is considered to be one of the greatest rising forces in the world, health is one of the most ignored topics in this, in our scope. We spend hardly 1.7% of GDP on it. America spends around 20%, which is too much, but we do definitely want to spend a little bit more. Our doctor to patient ratio is 1:1700. WHO wants it to be 1:1000. So we need to produce 67% more doctors, and we need to do it a lot cheaper. And even if we produce a lot more doctors, they don't want to go and serve in rural areas, right? So there's a huge issue with regards to that. In rural areas, the doctor to patient ratio is actually as high as 1:50,000. Which does cause a lot of problem. We have this age of super specialty, right? I mean, like, you have to go, every time my knee hurts, I'm supposed to go visit an orthopedics guy, when really I should be visiting a primary health guy who will probably charge me a little less, and also look at it not just as an orthopedic problem, but it could be an endocrinology problem, right? Primary health is very important, and it's influenced by what we eat, what we look at, the fact that we have genetically modified food coming our way, that's going to influence our health. Our air pollution influences our health. Do you know what is the biggest reason why people visit a doctor? It's respiratory issues, right? And the second biggest is digestive, right? But respiratory issues come in because you've got air pollution, and digestive issues come in because you have water pollution. So all these things do influence us, and we really need to be talking about primary health. Now, what's also happened once this thing decides to click, or it doesn't, I don't care. I'm just going to tell you what happens is that back in the 1950s, when we really got independent, what was killing Indians was communicable diseases, right? It was the malarias, the Haza, the good old cholera. That was what was killing Indians. Back in the 70s to right up till 2000s, we managed to control a lot of it, right? So it wasn't the malaria that was killing us. But then came the nice little heart disease and diabetes, right? And today, we have a triple threat because you have those diseases like malaria and cholera and leprosy coming back. You also have the wonderful chikungunya. I don't even eat chicken, and I got chikungunya. So, maybe I should have gunified it a little bit, and then I wouldn't have got chikungunya, but I got chikungunya. And I have, one of my relatives also got dengue, and those are the kind of things that are also coming back. So you have this triple threat that's actually going to make life really hell for us. And the only way around it is to actually have a really good primary health system. So back in 2011, I moved back from US. I was a professor in ASU. I was working with a Nobel Prize winner. I moved back because I thought, okay, let's figure out what we can do in India. And it's a great place. Honestly, it's a great place to innovate. You guys are in a place which at least advertises to be one of the most innovative places. I really encourage innovations because that's the way to go about I think improving India and improving your life around yourself. So we decided let's actually do that. When I moved here, I went to rural India. One of my more memorable times was where I actually managed to get an Anganwadi worker to feed me lunch. So she made lunch. Her room was very small, maybe like 10 feet by 10 feet type of a house, and at the corner of her house was like these 11 or 12 books lying on top of each other. And I asked her why, what are these books, and she said this is what the foundations do. They come, they give us a book, they take pictures with us, they feed us samosas, and they leave. And they say, just use this book every time somebody has diabetes, or use this book in case you want to guide a pregnant woman on how to actually improve her health, and so on. And I had my phone with me. I took out my phone and I actually sort of scanned the books, and I said, look, I've converted it into a digital book, so now you don't have to carry these books. And she listened to me very patiently, and she said, yeah, that's all okay, but unless you give diagnostics to people and you tell people what's wrong with them, they're not going to go to the healthcare system. And that was actually the beginning of this concept of Swasthya Slate. Swasthya, of course, means health. Then Slate, of course, means the tablet. So what we wanted to do was to actually make a device that essentially allows you to do diagnostics on the spot, anywhere, anytime, and do it really in an affordable manner, and also have the connectivity with the doctor. So what essentially it is you've got this little tablet. It's the same tablet that you can play Angry Birds on, or any of these other games you've got, or watch Kanchi's art. You can use this tablet for all the purposes, dark ones as well as good ones. But what we also have is this little bag, and the bag essentially is what carries all of the equipment that we actually require. You can see the little solar panel on top. So the solar panel actually helps you charge the device as you're moving around. That was something we really put in. It was colored brown because women who carry this bag, the auxiliary nurse midwives and ashas, were very keen that it doesn't show dirt, right? So black, you can actually see the dust particle. White gets dirty, but brown is very good to cover up any of that dirt. But we still kept a yellow patch on top in case we really wanted to see which asha is keeping it clean and which isn't. Right, that was there. It has nice little pads, so you can carry it. In fact, in places like Leh, this is being carried for 12-15 kilometers, and they're able to do it. We've got little elements that are there. We've also got a little raincoat inside the bag, so you can actually protect it if it's raining and you want to protect the bag from any kind of rain that's actually happening. So that's the crazy stuff we also ended up doing within that, so you can store it within it. I just want the bag. A lot of people just want the bag. And by the way, the bag, as you're carrying it around, will charge your phone, your tablet, and your laptop. So that's pretty nice fun within that. Back in the bag, we've got different tablets, got a little power backup, and this is actually the main device. So this is the device that actually does 33 diagnostic tests. These diagnostic tests, I'll put up the list if I can get this thing to work. Yeah, okay, let's see if I can get the thing to work more. This thing will rise up one of these days. But it includes blood pressure, blood sugar, hemoglobin, cholesterol, chikungunya, dengue, typhoid, malaria, HIV, syphilis. And what's interesting is, unlike other places where you actually have to spend 8 hours at least trying to get that, this is instant. You get all the results instantly. And that's been a big key driver in terms of what actually happens. I know this is a small enough audience, so I can try and be a little bit more thing. Back of this is where you actually keep all the tests. So you've got the blood pressure here, you've got the blood glucose, hemoglobin, you've got the pulse oximetry, you've got the body temperature, and then you have all these other tests. So for example, this is actually the chikungunya test. You literally drop blood on it, and within 3 seconds it will give you 2 lines in case you have chikungunya, 1 line in case you don't have chikungunya, right? And 3 lines in case it's undeterminate. And there's a little system by which you can actually just insert this into it, and it'll read those lines and be able to give you the results. We've also got things like a fetal Doppler. So in case you've got a mother and you want to check the baby's heartbeat, you've also got a fetal Doppler within the system. This is the hemoglobin meter. Let me maybe just show you my blood pressure and how this system actually works. It's quite simple. I'll try and be calm for my blood pressure, so you can actually see it. Now the device itself has just got things. It's got an 8-day power backup within the system. All you got to do is connect it via Bluetooth to this little tablet. And by the way, the software can work on any Android phone. It doesn't really matter what it is. So if I wanted to do my blood pressure, I'll just simply connect this. I know you guys probably can't see most of it, but it's got all these icons that allow you to choose the test. So you can see blood pressure, blood glucose, temperature, pulse oximetry, hemoglobin, whatever you want is right there. So you've got blood pressure. Now this is where it actually teaches you or shows you how to do it. So first thing is it'll tell you what is blood pressure. And by the way, it's available in multiple languages, so you don't need to know English to learn it. It's got Hindi, Punjabi, Urdu, within the system, Malayalam also. And there it actually then tells you how to go about it. So anybody who's using it, within 5 minutes they can actually learn how to use the device. We've designed it specifically for the frontline health workers to be able to do it. So I'll just show you my blood pressure and how this actually works. And it's as simple as this. I just simply, these icons are kind of fun. Play is something that everybody understands thanks to VCRs. So it's as simple as just saying play. It'll ask you if you have any symptoms. Move it on. Is the BP cuff on? Is it done? It just goes through a little bit of check. And there, it's actually got an inflation going on. So as I'm actually going around and doing this, the system has been made a lot more intelligent than what is already available, right? Much like what you saw with the talk with space tracks. Indianism is not just about taking an existing device and making it cheap. It's about true innovation that actually happens to be very, very Indian. So for example, I notice a lot of people move their hands when you actually have blood pressure being taken, which will actually throw in an erroneous reading. This system has an accelerometer in it. So if you go ahead and move your hand, it's going to throw an error. If I speak too loudly, it's actually going to tell me that you were speaking too loudly, your blood pressure will most likely come out to be a little bit higher. How do you do that? Well, there's a microphone in the bloody tablet, you can use that. So there are ways for us to be a lot more intelligent, because always, you know, you'll always have these people going, hey, a worker took these readings, is this actually going to be accurate or not? How can I trust it? So you say, okay, let us build in a few more checks and balances within this particular thing. The system actually will go ahead and reinflate and move it into, so good, mine came out to be 108.74, it's very nice, I'm quite happy. My wife will be super happy. Looks like the oats are bloody working. They taste like crap, but they you know, they do work. Now what's also cool about this tablet is what actually happens once you've taken these blood sugar readings. Let's say a woman comes in and she wants an antenatal care visit. So we know an antenatal care visit is very, very important for a pregnant woman, right? So let's go to the antenatal care visit app, and in the app, the system actually will go ahead and allow you to ask these mother a bunch of questions. So for example, you want to ask a mother about her nutrition, and one of the questions is, well, is the beneficiary taking folic acid? Now, do you know what folic acid is? I kind of know what folic acid is, but if you don't know, you just hold it and it'll actually come up with a hint on what folic acid is and why is it important for the mother, right? So we can answer these questions, and based on these questions, it's going to do something. So here's one question. Does the beneficiary eat more food than normal? So when you're pregnant, you're supposed to eat more food. But in rural areas, mother-in-laws, the omnipresent, omnipotent mother-in-laws will say, हमारे तो 12-12 बच्चे हुए, हमें तो ज़्यादा खाना खाने की ज़रूरत नहीं पड़ी, तुम्हें क्यों पड़ेगी? And they don't feed them, and this is an actual problem, right? So the mother says no. Here's another question. Do you sleep for 8 hours? Again, the omnipotent mother-in-law will go, हमारे भी 12-12 बच्चे हुए, हमें तो ज़्यादा सोने की ज़रूरत नहीं, हम तो सुबह जाके गाँव से पानी भर के लाते थे. So they will not let you sleep along. But what happens is, as soon as you press save on this, the system automatically generates advice that you send and you can say to the mother. It will say, look, sleeping is very important. If you don't rest, you have a higher chance of miscarriage, and your mother-in-law will be a lot less happier in case there is one, right? That's the key. So we are not just giving you diagnostics, we're giving you what do you do with the diagnostics. For example, in case you come in and you are bleeding from the vagina, as soon as you press save, it actually generates an automatic referral, which as soon as you press OK, goes to the nearest hospital. And in case there's no internet, it will actually reduce the mother's data into an SMS and send the SMS to the nearest hospital. And also, this is it's a tablet by which you can make phone calls. That's how you protect your mother. Now these are very simple things that any engineering student sitting in this group can actually do. The thing is, you need to listen to India. You need to listen to what India has to say, and then all these great ideas will actually come by. Let me walk you through. Can somebody help me with the clicker here, or just go through the slides? I'll get the groups. Chalo, I'll have to get up again. My knees hurt, but what the hell. All right, okay. These are the tests. Just we've actually got the tests: the general body checkup, the reproductive and child health, cardiac. I can actually even tell if you've had a heart attack with this tablet. We can do an ECG on you. We can also do a troponin test, so we can actually tell if somebody's had a heart attack. We can do vitamin D, uric acid, glucose, malaria, pretty much everything that is very, very critical. And what's important is that we've also expanded now the capability of this box to be joined with another box that can do an additional 180 tests and do an additional 560 tests, which is another box. So now you can pretty much do the entire lab on your tablet and move into that particular direction. All these tests are CE and FDA approved, which is really important. We want to make sure that everybody actually gets the same level of quality. Just because you're rural doesn't mean you get a lower quality device. There is clinical decision support. I already showed you how the system automatically generates advice. There is follow-ups. So when I marked that a mother is not eating, a week later the tablet will actually remind me to call the mother and ensure that she started eating more, right? And that's what actually produces the change within that. Oh, another thing. I was sick and tired of people telling me make this app, make that app. So I actually made a little system by where you can make your own app, okay? You don't actually need to be a programmer. You literally need to say, in this app, this is the question I want to ask. This is the diagnostics, this is the referral that happens, this is the follow-up. You put it into an Excel file, upload it onto my platform, it will generate the app for you, right? So doctors can actually just go ahead and do this themselves. I'm not your technology bellboy, right? So we've kind of gone ahead and moved into that direction within that. Let's see if okay, lots of cloud stuff. We have interfaced it with a finger praise system. In Maharashtra, we are working with the NACO, which is National AIDS Control Organization, and we're using it to actually give HIV and AIDS services. And we are using fingerprint as a way of tracking people and making sure they come to the clinic and move on. So that's already happened. I can tell you on a map where my high-risk mothers are. I can tell you on a map where my low-risk mothers are, because the system actually records GPS, right? So then I can go ahead and make sure that services actually reach those areas. We can also look at where the blood glucose levels are high, where the blood pressure levels are high, so on. Lots of projects that are actually going on within the system. So the National Health Mission, Innovation Foundation, Malaysia, 83 locations worldwide where we're actually there. This is one of my favorite things. How long does it take to get an antenatal care visit in Delhi right now? Even if you're a super rich woman, right? It takes half a day, right? Because you have to go, you get your test done, the doctor gives you some results, hopefully everything, minimum half a day, more likely 1.5 days, correct? Same with London, Paris, wherever the hell you go. Now in rural Jammu Kashmir, this used to take 14 days. Because you had to run from one facility to another facility to get tests done. Sub-health center will only do hemoglobin. The primary health center will do a subset. Some guys will do a subset. Then you go do all these tests, collect it together, bring it back to the sub-center. So it used to take 14 days to complete one antenatal care visit. With the Swasthya Slate bag in every sub-center, it's now being done in 40 minutes flat, which is better than you guys, right? And that's the key. The key is that a woman should not have to think of convenience when it comes to health. Health needs to be convenient. And I'll come back to this concept. These are just some of the results we've got. We've actually had a lot of fun with this. Before Swasthya Slate, the number of women who were getting, number of tests per mother was around 0.7 in these 6 districts of Jammu and Kashmir where we are live. Now it's around 3.61. So mothers are getting far more testing done. We've now surveyed more than 30,000 mothers. The last time this was done was around 29,788. But out of the 30,000 mothers, 912 were identified as high-risk mothers based on their diagnostic profile. Very happy to say each one of them is safe, and around 680 of them have already delivered very healthy and safe babies. Now that's very, very lucky, but it's also a part of the fact that we were able to give these results very, very soon and protect the mothers and protect the baby. This is just again a few more slides on it, and you can take a look at it. But what's also very fascinating for me was, you know, this is not just for rural India. This actually does work within the urban setups too. And in Delhi, we actually were given the opportunity to work in this little clinic called the Mohalla Clinic. So Piragadi, which is a kind of an urban slum in in the Punjabi Bagh area of Delhi. Arvind Kejriwal, I did not do that. I really wish I could, but I didn't do that. These guys are gonna flip. They're really nervous. Let's clap for them so that they can. Guys, you're doing a good job. Just don't worry. Okay. All right. Can we go to one of the slides? But let me talk about. Most of you have heard about Mohalla clinics, right? And it was actually featured in. Washington Post and everything. But the cool part about Mohalla Clinic, which I really enjoy, was that we used instant diagnostics to actually change behavior. See, today, I don't like to go to a doctor. The reason I don't like to go to a doctor is very simple, because it takes too long, right? To get to the pathway of recovery, it takes 2 days minimum, correct? What are you doing? You're kind of going, okay, yaar, abhi problem aaya, let's wait for this problem to get big enough, right? Then you wait a little bit more. Then you finally go to the doctor. Doctor says, go to the diagnostics guy. And he says, go to that very diagnostic guy, huh? Because that's my favorite guy. So then you go to the very favorite guy of this guy's, and then you go get the diagnostic done. Then by the evening you may get your results, which are now available on SMS and email, which is great. Then you call the doctor and say, you know, what's going on. If you're nice, the doctor may even want you to come back. And then he will say, okay, now you go to the pharmacist. Take this medication. And then the little chemist is looking at it and says, sir, ye to available hai nahi, iski jagah ye de दूं. And you kind of, it's irritating. It doesn't matter whether you're in the biggest hospital, this happens all the bloody time. So you go, why should I even go to the hospital or take this? So what does that mean? You wait for your body to literally fail before you take any action, right? And that's the key that's actually driving this entire thing forward. So for us, really, I mean, this is the workflow, right? This is the workflow. You wait for a problem to appear, you wait till it's unavoidable, you wait more, you go to the doctors, you get your basic prescriptions, then you come back to the doctor, get it filled by the pharmacy. You may take the drugs, you may not take the drugs, and you keep on going till the body fails again. And the relationship between a patient and a doctor is one of between a little girl and a horse or an ass, and you kind of, who's the little girl and who's the ass, I'll kind of leave it up to your imagination here. You're screwed around with that. Now with Mohalla clinics, and I'll try and wrap up within the next 2 minutes. All right, with Mohalla clinics, what was cool was you go and get yourself registered. Then you come to the doctor consult. The doctor writes you, here are the diagnostics I want done. You don't go externally. You go directly to a doctor, to a diagnostician who has the Swasthya Slate bag and apparatus. He does the test and he immediately sends it back to the doctor's tablet. Doctor sees you again, the pharmacy is right there, and you get your medication. This entire cycle in Mohalla clinic takes 4 minutes and 18 seconds. In 4 minutes and 18 seconds, you actually come out with a prescription. And what's really cool about this is it's driven by protocols. The doctor, you're not just depending on the quality of doctor, because the software actually makes the doctor follow a protocol and says, I will give you the best quality care, and no matter whether you show up in a Mohalla clinic in Piragadi or in Amsterdam, the quality of care is going to be similar. And that's the most important key here. The results have been quite spectacular. We're getting to see around 100 patients a day within this clinic, which is something that we're quite happy about. Now what's also fascinating is that a lot of people are now getting diagnostic tests done because it's available and it's easy to do, right? They're getting more frequently getting tested, but they're getting lesser medication. And that's what you want, right? You want people to come in before they need a medication, not when they actually need a medication. And that has been the biggest thing. 96% of patients do not need a referral. They are seen right there and then. Only 4% of patients actually need to go to the hospital. And that is the biggest key. Back in the 80s, we all had a neighborhood doctor with a little compounder and he'll give you medication. And that was a great system. Over the last 20 years, that's vanished. Maybe it's time for us to bring it back. For me, a man or a woman, there's actually a woman drawn here, I know you guys can't see this, but we are a product not just of our healthcare system interactions, but a product of our health behavior, our media, our geography, our background, our infrastructure. We know, for example, cities that have metro seems to have a better management of blood pressure, maybe because you're fighting all the crowds, or just because you're walking, that actually comes in. How do you get to this database is the key. With a paperless clinic, you're able to essentially take a bag like this, offer instant diagnostics to anybody and everybody, and be able to get their data and process it. So our clinics, by the way, don't just process your health, they also monitor air quality. They monitor local water quality. They monitor soil quality. And we're starting to draw these correlations of how the environment is starting to influence health. Swasthya Slate has been expanded to now include air quality sensors, NO2, CO, CO2. She can probably give me some more from the space stuff. We've already got that within the system. So we're starting to do this correlation between what's going on. We also get, sometimes people are kind enough to log in using their Facebook profiles. So we can even look at what your friends are doing and see how that influences health. So it's becoming more and more about individualizing. And the beginning is when you start thinking about this nature of instant, integrated, and comprehensive. It is instant. Diagnostics are instant. It's integrated because drugs, doctor, data, diagnostics, the 4 Ds, are coming together to deliver healthcare in one single roof for you. And it's comprehensive because it's not just looking at what problem you have, but it's looking at what your environment is. It's comprehensive because it looks at what you have been doing and what your social interactions are, and moving that into delivering care. That's my vision, guys, and I hope some of you will join me in fulfilling it. Thank you so much for your time.